Well, the Republican health care bill promises to be a big issue between now and next November's elections. As you can see from that ad that we just showed you from the AARP, it's already resonating. Not only would older, poor, and middle-class people get hit the hardest, but it also includes a lot of giveaways to the wealthiest in the form of tax cuts and tax breaks. Plus, it would increase the ranks of the uninsured by a whopping 14 million people next year alone, and 23 million people would lose coverage over the next decade. That's according to the nonpartisan Congressional Budget Office. CBO also saying the premiums, they'd go up an average of 20% next year, 5% in the year after that, and it's unclear what would happen after that, as there are too many variables to consider at this time. It also will likely vary widely state by state. But one thing is certain, states like New York, they could get hit the hardest, and my next guest explains why. Yesterday, I sat down with Dr. Safyer, who's president and CEO of Montefiore Medicine. Well, I want to say congratulations. You just got the Heritage Healthcare Innovation Award from Cranes, and you were honored because you were one of the people who leads a group that fundamentally changed how healthcare is delivered and champion new ways of thinking. If the House bill somehow becomes law, you're going to need magic tricks here to deliver health care, the very thing that you were awarded. Let's first talk about your hospital network, including in particular the one in the Bronx, and the type of patient that comes through your door.
Sure, that's great, Richard. And I appreciate your, what you said about the Heritage Foundation. It was really
Congratulations.
a terrific thing, but it's really for the organization, which is 35,000 people. It includes the Albert Einstein College of Medicine, 11 hospitals, 4 of them are in the Bronx, and 6 clinical affiliates. So it's a very large healthcare system, one of the largest in the country. It's about $5 billion. It is 45% Medicaid and 40% Medicare. The balance is commercial insurance.
Since the ACA went into effect, people for the first time in their lives have health insurance when they come through your doors.
Yeah, we saw a lot of people in New York gain insurance who are outside the system, so it was absolutely terrific. And in New York, children have been in it for a long time, but this added a lot of the adults, so it was wonderful.
Well, the news out of Washington, forgetting even for the moment investigations, etc., but whether it be the skinny budget that came out, the health care bill that got through the House, it's a double, triple whammy, and let's explain why in many ways. Things like acronyms like CHIP and SNAP. For some people at home, they may not have any idea what it does, and God bless them that it doesn't impact them. But if the budget were enacted in any way, shape, or form, and those things that are on the chopping block went away, in addition to all the draconian cuts to Medicaid, and the 24 million some odd people projected that would lose health insurance, all of a sudden that new person or that new family that had insurance for their kid or whatever else, now instead of coming through your doors looking and scheduling an appointment with a doctor, they're going to be coming through your ER as their first and last place of resort. Am I exaggerating in any way?
No, you're not exaggerating. And we've put a lot of people into comprehensive care based on the, actually the wonderful work New York has done for a long time, and then the boost of Obamacare. I view this as an assault, especially on places like New York and California. And we were talking earlier, the Faso-Collins addition to it, the amendment, does tremendous damage to New York State. It has been long-standing that local taxes help support the Medicaid program. If you have 1/3 of the state in Medicaid, you need resources. If we are at risk for $5 or $6 billion in New York State, this is horrible.
You know, a lot of people say, oh, you know what, it doesn't impact me. At the end of the day, the president says everything's going to be all right. If you got a pre-existing condition, nothing's really going to change. You're closer than me, but you don't even have to read the fine print. There are losers in this that aren't welfare queens, who I think people may associate this with. Seniors are going to be big losers out of this. People with pre-existing conditions are going to be big losers out of this. It's not just New York and California. You have a bunch of states here, including a lot of red states, where people are going to be left on the outside looking in. For people who will never read the fine print of this, give just how far-reaching the impacts could be if it somehow gets through reconciliation and somehow this becomes the new law of the land?
Right. It's an assault on the poor, and we've discussed that a little. It's actually an assault on the elderly because their insurance could cost a heck of a lot more.
They're saying maybe 5 times premiums could go up.
5 times easily, okay? And I'm talking not ancient elderly, I'm talking 50 to 64 before Medicare. We're talking about patients with mental health disease, drug addiction. We're talking about patients who are in the exchanges. And we were discussing that earlier also. In the country, we're only talking about 6 or 7 million people. In addition to that, it's very clear to me that they have in their eyesight Medicare eventually. They are talking about eviscerating all the public health support that we need. The CDC gets hurt in this budget proposal.
So, Doctor, administration says, hey, this thing, Obamacare, is in a death spiral anyway. All we're trying to do is fend off the inevitable. Take a look at Aetna, take a look at Humana, take a look at these insurance companies. They don't want to be a part of this anymore. How much of that's right, and how much of it is a self-fulfilling prophecy, if I can get it out, which is if you keep saying the end is coming and you create uncertainty in the markets for the hospitals, for everybody in between, of course the insurers are going to say, I'm going to get out now before it's too late.
Again, what we're talking about is 6 or 7 million people who are in the exchanges,
Yep.
some of them working in a country of 325 million. So I ask you, is Obamacare blowing up? It's not blowing up. There are parts of it that need to be bolstered, improved, and made better. Most people are in work-based insurance in this country. And they're going after that also, because in the bill that came out of the House, they gave an option for small businesses and large businesses to not have to be bound to providing
And if I could repeat that point for our audience, for anybody who thinks, well, you did or you didn't sign up for Obamacare and it will or won't impact you, your employer under this provision would have an opportunity to opt out. There's no more employee mandates for large corporations and even some smaller ones right now. So the pool of people impacted a lot larger than I think most people imagine. You're a doctor as well as also an executive for hospitals, for doctors, for insurers, pretty much anybody in the food chain that provides medical care. For them all to agree that this is a bad thing, that's rare, that everybody's on the same page here. But that, in effect, is where we are, isn't it?
It's hard enough to get a cardiologist and a neurologist to agree. Yeah, everybody agrees. Everybody is against it. And I'll tell you one more thing. Not overtly, but under the covers, the for-profit hospitals, which are mostly in the red states and mostly don't do complicated care like Montefiore does, are opposed to this because it's been a bonanza for them, because people coming into their emergency room are now insured.
And on that note, Doctor, I appreciate it, and I wish you the best of luck. And again, congratulations for the award.
Yeah, thank you.
And coming up next, the latest on the Russia probe, including new reports implicating Paul Manafort and Michael Flynn. And the panel is also going to join us to debate the Republican health care bill. How damaging will it be for the GOP?